Kothari Medical Center. It's my pleasure to speak something about diabetic retinopathy. But first of all, let me say a few words, a few things about diabetes. What actually is diabetes? What is diabetes? Diabetes is a kind of metabolic disorder in which there is high blood sugar due to lack of insulin. Insulin is a hormone which is secreted by the beta cells of the pancreas. What are the symptoms of diabetes? Frequent urination, going to the toilets. Secondly, excessive or increased thirst. You feel thirsty, more thirsty, and increased hunger. You feel hungry. And if the diabetes is not treated properly, then it can lead to complications. What are the complications of diabetes? It can cause heart problem, it can cause stroke, it can cause chronic kidney disease, it can cause foot ulcers, and eye damage, eye problem. The incidence, you should also consider what is the incidence of diabetes. About 422 million people are diabetic globally in the whole world, according to the 2016 data. And in India, 62 million people are affected by diabetes. This forms 7.1% of the general adult population. And the average age at which the diabetes start is 42 and a half years. Diabetes, there are two varieties of diabetes, type 1 and type 2. Type 1 affects younger people. It is also called juvenile diabetic, and it is, although it is also familial, that means it has got people who are affected has got family history of diabetes, and it is due to lack of insulin. Lack of insulin means the pancreas does not secrete adequate insulin to lower the blood glucose level. And then there is type 2 diabetes. In type 2 diabetes, it affects older people and is due to insulin resistance. What it means is that pancreas may secrete enough insulin, but it is not able to reach the target cells. Hence, it is not able to decrease the blood sugar. The function of insulin is to decrease the blood sugar level. And if it is not secreted enough or not active, it actually raises the blood sugar level, which causes a lot of damage in the eyes. Now we're coming to the question of diabetic retinopathy. High blood sugar, how does it damage the retina? There are two types of diabetic retinopathy. One is the non-proliferative diabetic retinopathy, the other is the proliferative diabetic retinopathy. Non-proliferative diabetic retinopathy, also called non-proliferative diabetic retinopathy, in which there are usual macroaneurysms, exudates, and hemorrhages, and it affects the vision by causing macular edema. The macular edema can be of three varieties. Macular edema, in which there is accumulation of fluid in the macular area, and the exudative variety, in which there is exudates in the macula, and then there is ischemic variety, in which the macula has no blood supply. There is ischemia in the macula. Macula is the central part of the retina, which is vital for seeing minute things. And vision is reading and writing depends on the function of the macula. It's the most important part, 5 millimeter area in the center of the retina, which is due to which you can you can see small prints. The rest of the retina is for peripheral vision. Now the type 2 actually it affects, no, not type 2, I mean proliferative diabetic retinopathy. I said about non-proliferative diabetic. Proliferative diabetic retinopathy affects more commonly to the younger people and those who are on insulin, and also in the later stages of non-proliferative diabetic retinopathy. Now, these are the two types of diabetic retinopathy, and in the non-proliferative diabetic retinopathy, how does it affect the retina? The blood vessels, retinal blood vessels are dilated. There is increased permeability of the blood vessels and the capillaries, due to which there is leakage of fluid in the retina, and retina swells, and this hampers the vision. In the proliferative variety, there is ischemia of the retina, and due to ischemia, there is neovascularization, formation of new blood vessels. These new blood vessels are very friable, fragile, and tend to bleed, and this is not very good for the retina. And it sometimes, when the hemorrhage or the bleeding is small, and the symptoms are that you get some kind of black spots in front of the eyes. But if there is a big bleeding in the jelly of the eye, that is vitreous, then the whole of the vision is lost. There is no, and then later on the blood settles and the vision comes back. But if it happens repeatedly, then the person can become blind. The long-term complication of the proliferative diabetic retinopathy is that it can form fibrous tissue in the jelly of the eye and the retina, and it pulls the macula, and thereby it causes diminution of vision, and it can even cause tractional retinal detachment. All these complications can occur. Now, what is the treatment of this? Treatment of the diabetic retinopathy. First treatment is the prevention. Now, how do you prevent diabetic retinopathy? First is a better control of diabetes, that means blood sugar. Second is that regular checkup of the patients, at least once in a year. Why to do that? Because to detect early diabetic retinopathy. The earlier it is detected, better it is treated, and better is the prognosis. So, every year, a diabetic should be checked for retina examination, but after dilating the pupils. And then the other treatment, the main treatment is by doing laser. Laser treatment, two types of laser treatment. One is to the macular edema, that means the swelling in the macular area, and the other is to pan-retinal photocoagulation, in which you do photocoagulation in the whole of the retina. Photocoagulation is to reduce the demand of blood supply in the retina. If you kill some parts of the retina by photocoagulation, the retinal new vessels, the new vessels, abnormal new vessels, they disappear gradually, they shrink, and thereby the further bleeding is prevented. The newer method of treatment for diabetic retinopathy is the intravitreal injection of anti-VEGF, that is vascular endothelial growth factor. It's a new kind of treatment which is going on for several years. The intravitreal injection is giving a small amount of injection into the jelly of the eye, and somehow or other it affects the eye in such a way that it reduces the edema, particularly the macular edema, and thereby it improves the vision. There are two main investigations for doing the for looking at the diabetic retinopathy. One is that one can do fluorescein angiography or what we call digital fluorescein angiography. One is FFA, fundus fluorescein angiography. In this test, we inject a dye in the blood vessel and it goes into the retina, and whenever there is leakage of dye in the retina from the blood vessels, it gives us a lot of information, and thereby we make a proper assessment and hence the treatment by laser. The other newer method of investigation of diabetic retinopathy is OCT, also called optical coherence tomography. By doing this, one sees this is a kind of test in which it sees how much retina is abnormal, how much swelling is there in the retina. And this is, if there is a lot of swelling, then the treatment nowadays is anti-VEGF, that means anti-vascular endothelial growth factor, which is very successful, and in many cases it gives good results. Is that okay?